One of the more common compensations during a squat is a hip shift. This is when you're coaching your patient or client through a squat and you visually see a shift towards that left side. Well, in this video, I want to talk about why the shift is actually an illusion. That patient or client may not be shifting at all, and it might be a different problem. So I want to talk about a more simplified approach as to why we see this hip shift, and then the solutions that we should go about to correct it. So the typical explanation as to why we see a hip shift during a squat usually comes down to two reasons. The first reason is that we quickly like to blame weak muscles. It's an easy way out, and we can quickly say, hey, Mr. Jones, you're hip shifting over to that side because you have weaker muscles on one side and stronger muscles on the other. The second reason is that that patient or client in front of you may be trying to move away from pain. For example, if they have a left hip shift, they may have pain in the right hip. So as they go down, we see this left hip shift as a way to offset and offload that right hip. Now, although both of these are factors, they're actually more of the symptoms. These are the symptoms of the true source. And in this video, I really want you to walk away with understanding a redefined and a simpler approach to fixing the source. And the nice thing is, when you fix the source, you always fix the symptoms. So the source of the problem truly lies within the pelvis and the rib cage, and more specifically, restriction or limitation within this posterior lower pelvis. Let me explain and let's go through the example. Let's first start with a normal squat. When your patient or client is squatting, we first need to understand that however they squat, we are watching them move through their path of least resistance. So if your patient or client has a good squat, we understand that as they go down, they maintain a vertical trajectory as they squat, and they are not being met with any sort of resistance that we wouldn't want. Conversely, when we see our hip shift to the left, we are hitting some sort of physiological limitation or restriction. What's really happening? Well, this is where I want you to start to rethink some things and understand that this actually isn't a hip shift problem. It's a rotational problem. As your patient or client goes down into the descending portion of their squat, when we visually see the left hip shift, what's happening is they're getting met with resistance back here. Think of it as a locked door. If you had to go through a locked door, but it remained locked and you couldn't go through it, you would quickly realize you have to find an alternate route. Well, when the body is met with a locked door or muscles back here that stay super tight and restrictive, they actually push. They compress the bones. That compression actually pushes. So what's really happening when your patient or client goes down into their squat and we see this left shift, they are actually getting pushed forward on the left and back on the right. This is the illusion part. The illusion looks like it's more of this shifting. And what happens when we just think about that illusion, then a lot of times we start to correct by cueing our patient with either a band or verbal cues to shift to the right to try to fix the problem. But in reality, they aren't shifting to the left. That's not the problem. That's more of the symptom and something we visually see. The problem is that they're getting pushed forward at this posterior lower pelvis as they go through their motion. That gives the appearance of this left shift, but in reality, they're getting rotated on the left in the forward direction or anterior direction, and the right side is moving through more of the posterior direction. So to fix this, we're not going to just cue them like we already talked about. Cueing them isn't going to unlock the door and get this posterior pelvis moving again. It's simply going to keep this dysfunctional rotational pattern, but get them to shift to the right as they squat. Instead, what we need to do is work on hip shifting activities, specifically hip shifting in the rotational aspect. What I mean is activities that draws the left side back and the right side forward. Now, for reference, if you had someone that was going to the right, they probably need to work the opposite. But 9 times out of 10, there's usually this need to draw the left back and the right forward due to the asymmetries of the body. Remember, we always want to know why we are doing something. So we said that we need to do these rotational hip shifting activities, but here's the why behind it. We already said that there is too much compression at this posterior lower pelvis. The cool thing is when you do hip shifting activities with the left side going back, as you see, the sacrum moves away from the femur. A lot of these muscles come around and attach here. This is going to help to unlock the door. It's already too locked and compressed. Rotational hip shifting activities with the left side going back is going to address and open the door. So the first exercise we can start with is a passive left hip shift. Now, like we talked about, it has the intent of opening up this posterior lower pelvis. So what we're going to do is we're going to be in a quadruped position. We're going to grab an Airex. You can do different levels of height. The higher you go, the more rotation you're going to get. And then we're going to put it under the left knee. When we do this, we put it under the left knee specifically because that's going to put the left pelvis back and the right pelvis forward. We can then further amplify this left back, right forward position by setting up with the right knee slightly in front of the left. From here, this is a passive exercise, so really we don't do much, but the things we want to focus on is getting in a position where we can start to feel that left back pocket. So I like to tell patients and clients to kind of move around, see where they get it. And normally what you want to do is go in more of a diagonal direction back. This is going to start to stretch these muscles across the back of the pelvis and start to do so in a way that opens up that posterior lower pelvis. Next, what we can do to make this more intense is go down all the way with the elbows, and we're going in that diagonal direction, and then all we're going to do is do 4 breaths, moving into it on the inhale, holding it on the exhale, and then we repeat. So the second exercise is a different variation of a left hip shift in that posterior direction. So now we're going to get a box or a bench or a chair, anything that can help position your lower extremity in a 90-90 position. So we're thinking 90 degrees of knee flexion, 90 degrees of hip flexion. From there, we're going to start to turn on the hamstring, the inner thigh, and the glute. Why? Because these are going to be super important muscles that need to be active in order to properly and optimally pull that left pelvis back. Then we're going to work on hip shifting. And really, in this exercise, you could go a lot of different routes, but for someone that's just starting, I just want to get a little hip shift where that right side's going up, the left side's going back. The ball between the knees helps to engage more of the inner thigh, but also gives the reference of drawing the ball back on the left and reaching up on the right, aka a left posterior hip shift and the right side moving in the anterior direction. So we'll put the ball between the knees. We're going to go down into that 90-90 position. Normally, you're going to have this right arm under the head. You're going to make sure your patient or client already knows how to find a posterior pelvic tilt, more of a stacked position where the rib cage is stacked on top of the pelvis. And then we're going to start to draw that left heel down into the box. Imagine that you are trying to kick your butt, but you can't because of that constraint. That's the direction that we're moving the heel in. We're going to gently start to press into the ball on the left to engage that left inner thigh. And then we're going to maintain our tuck, and we're going to reach the right knee up as we draw the left down. You should start to feel this back left lower pocket area, aka that posterior lower pelvis, and then we're going to come back up. As you start to progress, start to incorporate breathing. Inhale on the draw back, hold, and then exhale coming up. Make sure your patient or client really can see their knees and understand that the right knee needs to be slightly higher than the left. The last exercise is another variation of a left hip shift exercise. Now we're going to be in a half kneeling position. So each exercise is building upon one another and progressively getting harder. So what you'll do for this one is you're gonna make sure you're lined up by a wall and you have a foam roller. From there, we're searching for the same muscles. We need to get the inner thigh, the hamstring, and the glute. Why? Because those are the optimal muscles we need to try to draw back on that left side. From here, you'll go in a half kneeling position with the right knee down, the left knee up, and you are going to place the foam roller right on the inner side of the knee, and you are simply going to press down into the ground, biasing more of this inner posterior heel. You are going to gently push into the foam roller to engage that hamstring, and then we're going to work on drawing that foam roller back. Just like the other times, we want to make sure we have our stacked position, but as you draw back, we're going to inhale, and then we come forward on the exhale. Every time we draw back, we're really searching for that left back pocket, holding, and then exhale, coming back up.